Okay, good morning, everyone. Thank you for joining us today for our Q3 Health Huddle. Our goal today is to update you or provide you guidance for all things Medicare. We do not expect any of you to be Medicare experts, but we do want to provide you with enough information that maybe whenever fellow employees or elected officials come to your office with questions on what they need to be doing, you can answer them and point them in the correct direction. Joining us today is Rayshawn Collins. He is the Employee Benefits Consultant for the Northwest Territory. And then we also have two employee benefit specialists with us today, Kashay Hill from the Northeast and Megan West from the East Territory. So I am going to kick it over to Rayshawn Collins for his presentation. Thank you for joining us.
Thank you, Kathy. Greatly appreciate it. We want to make sure that we go over the Medicare information with all of you. This information is very vital to potential retirees and to any employees that may be thinking about Medicare, thinking about retiring. So the information I'm going to provide to you, please take notes. If you have questions, please ask as well. So I'm going to share my screen from a presentation that I gave yesterday. I was actually in Henderson County. I've gone to a few of the other groups in the Northeast Territory that I service with this presentation. So again, if you have questions, please ask. If you want to write them down, if you have thoughts, please write those down as well. So let me go ahead and share my screen so that you can see what we will be discussing. So first, I do have our Northeast Territory team. Myself, Michelle Gifford is our wellness consultant. Kashay Hill is the employee benefits specialist. So we work very well with all of you guys in the Northeast Territory to get many of your questions answered for benefits and things of that sort. So let's jump right into the presentation. Who is eligible for Medicare? Medicare eligibility is for people age 65 or older that are U.S. citizens or permanent residents, and you have to have lived in the U.S. for at least 5 years. So this portion is age-based. You may qualify for Medicare under a disability-based if you are under the age of 65. And then Medicare is also health condition based. If you have anything such as end-stage renal disease that requires dialysis or have had a kidney transplant, you would qualify for Medicare. Lou Gehrig's disease, also known as ALS, will also qualify you. And you are automatically enrolled in Medicare when you receive SSDI under these health condition based eligible conditions. The next thing I want to talk about with this are what we call our different parts of Medicare. Medicare, if you're not aware, you're going to get a red, white, and blue card in the mail. Okay. Your member ID number on that card will be alphanumeric characters. So when you first get Medicare, if you are still working, you can enroll in Medicare Part A. This is what we know as the hospital portion. It is premium free, so it doesn't cost you anything. So essentially, while you're still working, if you're 65 or older, you can have Medicare Part A. Part B, you don't need that at the while you're still working. That is the medical portion. That does have a monthly premium. If you are thinking about retiring before the end of the year, the Medicare Part B premium is $202.90, and it has increased steadily over the last 10 to 15 years. There's going to be almost a $7 increase for 2027. So it's going to go to like 209, almost $210. Part C, that is your Medicare Advantage plan. In order to get a Medicare Advantage plan, you have to have Medicare Part A and B. And most of the Medicare Advantage plans have a premium that starts at $0, but you are still responsible for the Medicare Part B premium that Social Security will deduct from your Social Security check each and every month. The Part D portion, that is the prescription drug portion or the pharmacy. This is included with the Medicare Part C. However, if you purchase this separately, it does have a premium associated with it. And then we do have Medicare supplement plans. The supplemental plan is going to be essentially helping you pay for anything that Medicare doesn't cover while you have original Medicare. Now, you do have to pay for dental, vision, and the prescription drug plan separately if you were to take a supplemental plan. So, there are basically three ways you can get Medicare. You can have original Medicare, which is the red, white, and blue card, or you can get a Medicare Advantage plan. That is going to be your medical benefits. And those benefits, you're going to have co-pays or co-insurance applicable, and you may have a deductible applicable to certain medical services as well. Or you can get a supplemental plan. All right. Moving forward to the carriers for Medicare. There are some carriers, we like to call them major players within the Medicare realm. You have United Healthcare, you have Blue Cross Blue Shield of Texas. I'm sorry, Blue Cross Blue Shield. We are in Texas, so it would be Blue Cross Blue Shield of Texas. You also have Devoted, WellCare, Aetna, Cigna. Those are some of the major carriers that are applicable to your Medicare Advantage plan, your supplemental plan, and your prescription drug plan. So any of these carriers, you would be able to choose one of them for a Medicare Advantage plan or with a supplemental plan. And again, if you are going to choose a supplemental plan, essentially you are paying for everything a la carte. So you're paying for a supplemental plan, you're paying for dental, you're paying for vision. Okay. So those are all the things that would consist of a supplemental plan with Medicare. Under the Medicare Advantage, the medical, dental, vision, and prescription drug plan are all included with that particular plan. So you're not having to pay for those separately. They are all inclusive. So moving over, what does the Medicare Advantage plan offer? Again, it offers medical, it offers dental with or without a maximum benefit, and I'll go over that in just a moment. It includes vision, the prescription drug plan, and there may be a possible OTC card, over the counter card, based on the area you live and if you have or if you have a qualifying medical condition. Qualifying medical condition would be a diabetic diagnosis, a cardiovascular diagnosis, or a pulmonary diagnosis. Those are typically the three conditions that may qualify you for an over-the-counter benefit card. And again, there is a zero monthly premium that 90% of the Medicare Advantage plans start at. Again, you as the Medicare beneficiary are still responsible for your Medicare Part B premium, and those premiums do vary based on the location that you're in within Texas. All right, so when do you need to enroll in Medicare? You get a 7-month window. This is called the initial enrollment period. So you get 3 months before you turn 65, you get 3 months after you turn 65, and it also includes your birthday month. So for example, if your birthday were to fall in the month of March, you would get December, January, and February as the 3 months before, and you get April, May, and June as the 3 months after, including your birthday month. All right. Now, if you were to miss that initial enrollment period, there is the annual election period, which is not listed here, that falls between October 15th and December 7th each year. This annual election period will allow Medicare beneficiaries to either select a new plan, keep their current plan, or if you miss this period when you first turn 65, that 7-month window, you could use this as your initial enrollment period as well. If you miss the annual election period, there's a general or open enrollment period that goes from January 1 to March 31 every year. So essentially, you get multiple election periods to enroll into Medicare. Okay. And there's something called a special election period. So if you were to move, you lose your employer coverage, or you qualify for Medicaid or extra help, or if a disaster were to occur in your area, you could use the special election period to change your plan as well. Having been in the Medicare space, I wouldn't recommend changing your plan every 3 months or every single time you get a call from someone. You want to make sure that you're establishing your care and establishing good rapport with your doctors that you see, whether that's your primary doctor, whether that's a specialist. So changing your plan constantly isn't really beneficial to you having the benefits, but you are able to do it. I just wouldn't recommend it. Again, with all the carriers that are out there, we do know that there are Medicare beneficiaries that are loyal to certain carriers. And so being loyal to a certain carrier is very good, but we want to make sure that we maximize those benefits for you. So let me go back and talk about the benefit of the dental maximum that I mentioned a little bit earlier. So under a Medicare Advantage plan, there are um, dental benefits that you can receive. Some plans will only cover your preventive care, which is just your exam. You have other plans that will cover a maximum dollar amount. So let's use $1,000. So what that means is that first $1,000, you are not responsible for that toward your dental care. That first dollar above that, you would be responsible for dental care for the remainder of your plan year. So typically you could have a plan year that goes from August 1st. Since August 1st is coming up, we'll use that. Your plan year would be August 1st to December 31st if you make any plan changes during the annual election period between October 15th and December 7th. So essentially what some people will do is to maximize their dental, they'll use that $1,000 at the end of the year, like in December, and they will make that new plan election that's going to start in January. They may find an increase of $1,500, $2,000 based on the dental care they need. So essentially, within a short period of time, you get a maximum of $3,000. Your current plan of the thousand, and then your new plan if it were to have a $2,000 benefit. So you could get a lot of dental care done without paying a lot of money out of your own pocket. All right. Do we have any questions that came in that I can get answered? Okay, awesome. So essentially, these are the benefits that Medicare offers to you, the eligibility, different things like that. I do want to bring up one change that just took place on yesterday for 2027. The prescription drug plan, the subsidies that they offer for those plans will be going away next year in 2027, starting sometime in January, I believe. So there are going to be premium increases to the prescription drug plan. Also, the prescription drug plan does have a maximum out-of-pocket benefit. Currently, for this year, it is $2,100. In 2027, it's going to go up to $2,400. So basically, what that means is if you're paying for any medication while you're on Medicare with a prescription drug plan, once you meet that 2,100 for this year or 2,400 for next year, the plan will pay 100% of your prescription drug costs for the rest of the plan year. Now, having said that, if you were to start, or I'm sorry, if you were to change your plan, so let's say you have Blue Cross Blue Shield. If you changed your plan from Blue Cross Blue Shield in August and you went to United Healthcare, that $2,400 is going to start over because you changed your plan. It does not carry over. So every time you change your plan, that benefit starts fresh for you every single time under the prescription benefit plan. So be cautious of that because you may think, oh, I met 2,100. I don't have to pay for my prescriptions for the rest of the year. The different insurance carriers don't talk to each other. So that benefit's going to start over for you every single time. So if you change your plan every 3 months, you're going to have to meet that $2,100 while you're on that particular plan every single time. All right. If there are any questions, please let us know in the chat. If you want to talk to your benefit consultant in your territory afterwards, please reach out to them for questions as well.
Okay, thank you, Rayshawn, for that information. Um, what we're going to talk about now is I'll keep in mind some of your groups, um, y'all are participating in County Choice Silver. And so there, the county also, the employee or elected official also needs to meet the county's retirement requirements and, all of that. Any questions on that, be sure and reach out to your employee benefits consultant. We are more than happy to discuss that with you and go over it as much as possible. I know for my groups up in the Northwest, I've, come and talked to employees who are getting ready to retire and they're looking at all of their other options. Also, the key thing is to keep in mind, if your group does have County Choice Silver through TAC, is once they have waived that coverage, if they don't sign up whenever they are getting ready to retire and they move on to a different supplement plan, Medicare supplement plan, or Medicare Advantage, they cannot come back and enroll in County Choice Silver. With County Choice Silver, if this is something that your county or entity is looking at starting, we need at least 90 days from the day that all the paperwork is signed and turned back into us. We are more than happy to come and talk to your court about the benefits of providing this benefit to your 65 and older retirees, because this plan is a true Medicare supplement benefit instead of them having to go on the market and do all this research themselves. Keep in mind, there are several ways you can offer this benefit as the employer. The groups do not have to, the county or the entity does not have to contribute for the retirees. It can be completely paid by the retirees, and there's different ways we can help get that set up and answer any questions. But there again, we will also come and talk to those that are getting ready to retire and try and help them navigate. Now, one of the things that I do want to talk about, and I'm going to share my screen, is there is in the open enrollment toolkit, and I just want to confirm with my team in office, is that full screen? No? Let me see
There
if,
it goes. There it goes.
okay, it's a little bit of a delay. Sorry, guys. On this is information regarding Medicare, enrolling in Medicare. We also have, and I'm going to click on it and hopefully you'll be able to see it. And that I do not know how we can get that to a full screen, but it's helpful hints and different things that that is helpful hints. Sorry for you as the person doing the benefits in getting that the CMS filing. So we have provided all of that. Let me go the credible coverage. This is another important piece of information for all of your employees who are getting ready to, why won't that open? I had it earlier and did something different. Sorry, guys, I apologize. This is the form that you need to edit based on your group's or entity's information to pass out to all of the people who are getting ready to turn 65. This way they can take that information into whenever they go and start filing for Medicare, and that would help prevent them from getting some of those penalties. And they will need to provide that to Medicare at the time of their enrollment. Now let me see if I can get out of this without completely messing up. Yay, I did something right. And for those of you who know me, I'm patting myself on the back. There is, that's Medicare disclosure. We have a lot of information in here on the life binder. Sorry, I did miss that in providing that, saying that whenever we did it. This is the life binder link. So it has a lot of information regarding just the annual enrollment process as far as when to make the changes for this renewal period. But we are getting so many questions because there's a lot of people. We're going to see a lot of turnover this year. And some of you that are watching, I saw one of you log on. Um, you are getting ready to retire yourself, and I've tried to talk you out of it. You will not agree to go with me and not. But all of this information is here. Um, and hopefully, you won't have any issues. It's all of the documents, new hire, how to go in and do ESS or the employee self-service portal, how to go on and do all of that. I believe the employee benefit specialist is going to be talking about special different things and helpful hints, understanding Medicare, the Oasis login portal. And we do have a helpful hints that you can pass out to your employees, and let me go back and try and find it. Medicare facts. I found it. Yay. This answers some of that Rayshawn was covering. So it just explains what Medicare is, what he did, the different parts. That is very confusing. And like I said, we don't want y'all to have to become Medicare experts. If you are, we may utilize your services for that. But it changes. And so there's all of that, how they can enroll, when they can enroll. Do you have to be age 65? Is it free? Like I said, just a lot of information there, but we want to make sure you and your employees or elected officials are you're not blindsided. And the other thing I want to caution people who are going is don't be afraid to ask them questions. Many of you have heard me talk about the insurance language and just how confusing it is, and we always don't want to ask questions. This is very, very important to ask those questions because it could be something that you're looped into or you're roped into for a long time. So there's all of this information. My suggestion would be, if you're getting ready to hold an open enrollment, annual enrollment session, print off these frequently asked questions. Go ahead and get that credible coverage form. Go ahead and get it edited for your information to pass out to those employees. That way they have it ahead of time. Also, I am always going to suggest for the retiree to keep that credible coverage form. Keep a copy of it for themselves. That way they always have a copy of it. And I say this because I actually had a retiree from a group that they turned it in, and somehow in the Medicare system, it all got lost. And they got penalized. So if they always have that information, that does help. But there is a lot of information whenever it comes to Medicare, and that information, keep it on file. Always, again, please do not hesitate to reach out to us. That's part of why we're here, why we love doing what we do. Do y'all have any questions? I went over that very fast. Rayshawn, you were talking about earlier, there was a couple of websites that we wanted to be sure and point out to the members. Could you have you put that in the group chat yet? Rayshawn is going to go ahead and put that in the chat because they also provide additional information. One of the things that I also do want to point out is TCDRS, and I know y'all probably can't see this very well. Yeah, it's another good resource because there's a lot that the employees are going, the soon to be retirees are going to have to navigate. And I actually saw this week at an annual enrollment with one of my groups. They can help the person who's getting ready to retire set their dates and when their anticipated payment is. Many of you know I'm a former treasurer myself, and I would try and help people navigate this. And I had one employee who was getting ready to retire, and from their date of retirement, it was going to be 6 weeks before they got their first check from TCDRS. And some people can't go that long. So they can contact TCDRS. They have the app. They have all of this information at their fingertips. You can contact TCDRS if you are the person for your entity that's handling the benefits and this portion of the benefits for your employees. Contact TCDRS. They are more than happy to send out these little flyers. It's not just for retirees, it's also for if somebody just leaves. They have a lot of information that is available for you to use. Does anybody have any questions so far? I've gone through this kind of fast. I'm not sure if you were able to see um, the link that I just shared. It has a lot of good information. Um, okay, if they do not have Medicare at the time of retirement, but are over 65. Okay. I'm sorry. Can someone else on the team read that full question?
Yeah, I got it. So this is from Tommy Riggs. He's with Kaufman County.
Okay.
So if they do not have Medicare at the time of retirement, but are over 65, is it correct to say that they could do County Choice Silver when they make retirement official and start Medicare? So they could do County Choice Silver once they retire, as long as they have Medicare Part A and B at that time, because you cannot have it while you're still working. County Choice Silver is for once you retire.
Okay. Are there any other questions? Oh, Cynthia, you were asking about the link. Are you the link that I was referring to was in your open enrollment toolkit. It's the live binder. Um, And then she says, okay, got it. Guys, keep in mind, anything that we mention, please reach out to your employee benefits consultant or even your employee benefits specialist. We can help get you, if you missed it, we can resend that information, or we can provide the links. So you have that information. If y'all do not have any other questions for me, I am going to turn it over to Kashay and Megan to talk about the employee benefit specialist hot minute. So guys, take it away.
All right. Thank you, Kathy. I am Megan West. I'm the Employee Benefit Specialist of the East Territory, and I'm here with my teammate. I'll let her introduce herself.
Good morning. My name is Kashay Hill. I'm the Employee Benefits Specialist for the Northeast.
Okay, so we are in the EBS minute. So during this time, we want to talk about annual enrollment season that is just around the corner and just give y'all some helpful tips and tricks. The first thing I want to bring up today is the OASIS training videos. So we did get a new link for those training videos. They're a little bit more revamped. Now you can click on specific topics to help you process anything that you're unsure about or get step-by-steps in those videos. One helpful thing about these videos, it just has an OASIS overview. So if you are in a county that doesn't have a lot of changes, maybe you're not in OASIS a lot, this might be a good refresher of just how OASIS works or basic processes that might be helpful during this season. For the next little thing we're going to talk about, I'm going to turn this over to Kashay. She's going to have some helpful reminders when going through the processes of making changes for your employees. So Kashay, take it away.
All right, so we want to make sure that when we're making updates in OASIS for annual enrollment, that we're in the correct plan year in OASIS. So be sure that you're checking the top left corner to make sure that you have selected the drop down for the correct plan year to make those changes. Um, we've also, in addition to the training videos, we've also sent out an email notification with helpful tips on how to make changes for new hires and rehires during the dual plan year. So if you're an Oasis user, you should have received that email notification. If not, or you have any questions, please feel free to reach out to your EBS. We'll also want to remember to review your edits on the election history page under the participant benefits tab when you make those changes. We want to make sure that an error hasn't generated, so please be sure to go back and check the election page to ensure that all enrollment selections were made properly.
Thanks, Kashay. Those are just some few helpful tips and tricks. And like we said, and like we always say, please reach out to your team if you have any questions or concerns. We're here to help. We want y'all to feel comfortable and confident during this process. So if there's anything that we missed today or any concerns that you have, please reach out to us. Thank y'all. And Kathy and Rayshawn, did y'all have anything else y'all would like to say? All right. Well, then we've cut it out early. Thank y'all for y'all's time. I hope we said some helpful things today. If you have any other questions, we'll be around. Have a good one.